Welcome to this educational video about coronary artery spasm, also known as Prinzmetal angina or variant angina. We'll explore what this heart condition is, its causes, how it affects the heart, and the available treatments. Coronary artery spasm occurs when the smooth muscle within the wall of a coronary artery temporarily constricts or tightens. The exact cause isn't always clear, but several factors can trigger these spasms. These include exposure to cold weather, emotional stress, smoking, and the use of certain drugs like cocaine. In some cases, underlying conditions like atherosclerosis or hardening of the arteries can make individuals more susceptible to spasms. Normally, coronary arteries supply oxygen-rich blood to the heart muscle. During a spasm, the artery narrows significantly, dramatically reducing blood flow. This sudden reduction deprives the heart muscle of oxygen, a condition known as ischemia. This ischemia leads to chest pain and other related symptoms. Unlike typical angina caused by blockages, Prinzmetal angina is caused by the spasm itself, often occurring at rest and sometimes at night. Prinzmetal angina is relatively rare compared to typical angina. It affects people of all ages but is more commonly seen in younger individuals than typical angina. While precise global statistics are difficult to obtain, studies suggest it accounts for a small percentage of all angina cases. Certain populations, such as those with a history of migraine headaches or Raynaud's phenomenon, may have a slightly increased risk. The hallmark symptom of Prinzmetal angina is chest pain, often described as squeezing, crushing, or tightness. Unlike typical angina that's triggered by exertion, this pain often occurs at rest, particularly between midnight and early morning. Other symptoms may include shortness of breath, lightheadedness, nausea, and sweating. The pain can sometimes radiate to the jaw, neck, or arms, mimicking a heart attack. Diagnosing Prinzmetal angina can be challenging. An electrocardiogram or ECG during an episode of chest pain often shows characteristic changes. However, these changes may not always be present. A Holter monitor, which records heart activity over 24-48 hours, can help capture intermittent ECG changes. Coronary angiography, a procedure where dye is injected into the coronary arteries to visualize them, is often performed. A provocative test, where a medication is administered to intentionally induce a spasm, may be conducted during angiography to confirm the diagnosis. While there aren't distinct types of Prinzmetal angina in the same way there are for other diseases, the severity and frequency of spasms can vary greatly between individuals. Some people may experience infrequent, mild spasms, while others may have frequent, severe episodes that significantly impact their quality of life. This variability influences treatment strategies. The primary goal of treatment is to prevent and relieve coronary artery spasms. Medications are the cornerstone of management. Calcium channel blockers are commonly prescribed to relax the smooth muscle of the coronary arteries and prevent spasms. Nitrates, such as nitroglycerin, are used to quickly relieve chest pain during an acute episode. In some cases, long-acting nitrates or other medications may be used to reduce the frequency of spasms. For individuals with significant underlying atherosclerosis, lifestyle modifications and medications to manage cholesterol and blood pressure may also be recommended. Rarely, a stent may be placed to help with the spasm. While completely preventing coronary artery spasm may not always be possible, several lifestyle modifications can help reduce the risk and frequency of episodes. These include quitting smoking, avoiding exposure to cold temperatures, managing stress through relaxation techniques, and avoiding recreational drugs like cocaine. Adhering to prescribed medications and regular follow-up appointments with a cardiologist are also crucial. The prognosis for individuals with Prinzmetal angina varies. With proper diagnosis and treatment, many people can effectively manage their symptoms and live relatively normal lives. However, untreated or poorly managed Prinzmetal angina can increase the risk of serious complications, such as arrhythmias or even sudden cardiac death. Recent research focuses on identifying specific genetic factors that may predispose individuals to coronary artery spasm. Studies are also exploring the role of inflammation and endothelial dysfunction in the development of spasms. Advances in imaging techniques are also helping to improve the accuracy and efficiency of diagnosis, leading to more targeted and effective treatments.